That day when I went, the previous day, the daughter, 18-year-old daughter, had committed suicide. They're immediate neighbors. And the lady was telling me, in the last 1 month, that girl came to me and asked me 3-4 times, Auntie, कैसा होता है वो ये सुसाइड करते हैं ना, कैसे लगता होगा, उनको डर नहीं लगता है क्या, उनको ये नहीं लगता. So many things she would have. Thrice she had asked this, it seems. Passing conversation. In fact, she asked, how do they do that? How do they tie this? And so many things. And then she was telling that I wish I could have told this, informed at least the parents. And I was thinking why she's asking this. Not just once or twice, 3 times in a week or so, in casual conversation. So that's the time, this thing and the pandemic raising it, I thought we should at least make it available to whoever is interested. And my also sincere request is do spread the word around after this. This is for every population, all age groups, and specifically if any of you are interested in detecting in specific age group of children, even that the speaker today will be available to guide you and share some tips on how to detect it before they regret it. So thank you very much for being a part of this program this evening. Now I hand it over to our Mr. Deepak Bharwani, our dear Dayaluram Prabhu, to introduce the speaker and the presentation. Thank you very much. Hare Krishna.
Hare Krishna. Thank you very much, Prabhuji. Yes, sometimes you have to live with the guilt that, we could not help somebody. And that's also very painful. We have with us Ushamati Mataji, who's has a heart of a devotee and the intellect of a clinical psychologist. She is a practicing clinical psychologist at the Bhaktivedanta Hospital, and she is the counselor at Gopal's Garden School. She, apart from counseling, also conducts workshops on psychotherapy and emotional well-being. She has clocked more than 5,000 hours of counseling, helping people. And we have a lot of experience behind her, which she's going to unfold. So with these words, over to you, Mataji. Just a small note, I'm sure we will have many questions. Please post your questions on YouTube or Facebook, and we will take them towards the end. Thank you very much. Over to you, Mataji.
Thank you.
Mataji, we can't hear you.
Okay. Okay, sorry. Hare Krishna and good evening to all of you. Welcome to this session of detected or regretted. We're talking about depression here, and you must be wondering why we took this, topic. But it is, I think, very, very valid in the current circumstances that we're living in today, and also because it has been, a part, like, almost 264 million, as Radha Gopinath Prabhuji mentioned, almost 264 million people have been affected by depression, are affected by depression every year. This is worldwide, and in India it is more than 10 million every year. So these are just small statistics that I would like to share with you, and without wasting too much of time, I will just move on to the today's presentation. So today we shall be covering various topics under, detecting depression. Some of them are mentioned here, like what we will be understanding what depression is, what causes depression, What are the signs and symptoms? How do you identify if somebody has depression? And diagnosis criteria, which will be very brief because that's very technical. Then what is the cycle of depression, how it starts, how the vicious cycle takes over. Then how can we reverse it? There is a way of reversing the cycle also. What are some of the self-help techniques that I'm going to share with you? And how to help your loved ones. The last time I had conducted this session, people had asked this question, so I thought I should cover this also in this session. The pandemic effect, the current situation, what is the what are the issues that all of us are facing, how we can change our focus from getting into this daily rut of getting into negative thoughts, worries, anxieties. How do we change our focus? And so we move on to what actually understanding what depression is. Now it is a very common mental health disorder, classified by WHO, that's WHO, World Health Organization, and it's also one of the main causes of disability worldwide. So we can imagine how deep rooted and how widely extent it is. 264 million people affected every year worldwide, and in India, as I mentioned, 10 million every year. More women are affected than men. Now we need to look at this because why more women? Because by nature women are emotionally very they are more emotional by nature, I would say. Hence they are more susceptible. And in my so many years of experience, I have seen that they are the ones, mostly I should say about almost 90% of the cases that have come to me, the women have suffered some kind of abuse. It could be mental, physical, sexual, what emotional, any kind of abuse. So they are more susceptible to this kind of trauma, although they are strong mentally or emotionally, I would say, but still they are the ones who are susceptible. But that does not mean that men do not get affected by this. Men are also affected, although the ratio is lower. So as I mentioned earlier, it can happen to anyone. So we need to remember one thing, that depression or accepting that you have a problem is not a sign of weakness. Denying is a sign of weakness, but at the same time, but if you accept the problem and work on it, that is definitely going to give you and build your strength. Okay, we have to remember that depression can be treated. It can happen to anybody. It is not a sign of weakness, and it is treatable. So treatable, it could be in the form of medications, it's in the form of therapy, or even light, mild, exercises which are sometimes given if it is very mild. Okay. So this is like a definition of what depression is all about. It is a mood disorder, definitely, where the mood keeps fluctuating. Most of the times the mood is low, but in some cases we have manic depression and we have, bipolar, which is, a high fluctuation of mood, which goes up and down. So what does depression actually involve? It involves a persistent feeling of sadness and loss of interest. So here, the word persistent is given a lot of importance because it is something which is with you for some time. It's not something which comes and goes. So we will look at the duration of time now. And it is different from normal mood fluctuations. I will highlight on this also later. Now, persistent means at least it should be there with you for 2 weeks. This, feeling of sadness, loss of interest, lack of enthusiasm. So this should be there continuously, persistently for at least a minimum of 2 weeks. That's when you actually start. You should reach out for help. Now, I would here also like to explain how it is different from a normal, mood disorder or more normal, mood fluctuations that we have on a day-to-day basis. Now, on a regular basis, what happens is that sometimes you feel a little low, sometimes you feel high. For women, before the menstrual cycle also, they have some hormonal changes. So because of that, they also feel, a little high and low. For men, it is like sometimes there is a lot of stress at work, so they start feeling high or low because of that. So these are normal. But when these sensations start becoming overwhelming for you, when you feel that you are not able to function, normally in your day-to-day life.
Mataji, we can't hear you.
Me.
Yeah,
Okay.
we can hear you now.
Yeah. So where was it? So when this feeling becomes overwhelming, over a period of time, from the normal fluctuation that we ups and downs, but when it starts affecting your day-to-day activities and you become more and more dysfunctional, that's when you start it's like a warning bell. You need to take stock of the situation. It's an ongoing problem. It's not a passing one. So if you get depression once, it could happen. It may happen that it will relapse after a few years again. You may take medications, but if you don't continue with your sessions of therapy and also implement it regularly in your day-to-day life, then it is possible that it can come back. It's very similar to physiotherapy. Whenever you have a backache or a shoulder ache, what you do, you go to a physiotherapist and he gives you a set of exercises. You practice it for some time, you are okay, and then you say, okay, fine, now I'm fine, I don't need it. But then after a few years, it's a recurring problem. It comes back. So unless and until you practice it or you do it, implement it regularly, consistently, it is going to be an ongoing problem, like any other disorder or a disease that you get into. So as I mentioned earlier, episodes should last for at least 2 weeks and it can go up to several years. Sometimes it's a dull depression which is there for a period of more than 2 years or 3 years. Sometimes it's even there for 5-6 years, I've observed, but people don't realize it. They don't realize that they're depressed, but because it's a very dull feeling. So we need to be aware and alert regarding these feelings. Now we move on to the signs and symptoms of depression. The first is that, of course, it's a depressed mood. You feel very low. There is reduced interest or pleasure in activities that you once enjoyed. Like suppose you enjoyed going for a walk, or you enjoyed going for a swim, you enjoyed listening to music, you enjoyed cooking, you would find an interest reduction or a reduced interest or pleasure in the activities that you enjoyed. A loss of sexual desire, changes in appetite, your appetite becomes low. Even in terms of sexual desire, you don't feel like, you don't feel motivated enough to engage in any sexual activity. Unintentional weight loss or gain. See, we also need to remember that these are signs and symptoms of depression, but they could also be symptoms of other, disorders like when you have thyroid or you have sugar problems, also there is a change in weight. So you need to check out a complete medical, condition before coming to a conclusion that you are having depression. Sleeping too much or too little. There have been cases which I've handled where people have come and told me that I don't feel like waking up till 2 in the afternoon. That's the situation. I don't feel like brushing my teeth. I don't feel like eating. I don't feel like taking a bath. So these are the conditions, symptoms of chronic depression. Okay. So either it is sleeping too much or there is there is lack of sleep. You sleep for 2 hours, you wake up and then you're just thinking and worrying all the night. Next is agitation, restlessness, pacing up and down. So suppose you're not able to sleep, what happens? Your brain becomes alert and then you're just moving around in an agitated manner. You feel very restless. You keep moving up and down because of lack of sleep or lack of any activity for that matter. Slow movement and speech. There have been many times that I've come across people who speak with a slur or, who speak very slowly. Their speech is very measured, or they are not able to form sentences or bring out, or not able to get the right vocabulary while they are speaking. So these are all some of the signs and symptoms of depression. Fatigue or lack of or loss of energy. You can say lack of enthusiasm, very, very tired, exhausted, fatigued, and you just don't feel like doing anything. So that's it. Feelings of worthlessness or guilt. Now, this is very, very important because this could lead to further complications. This particular feeling of worthlessness or guilt, if you are suffering from that, That is the first thing that anybody needs to address, because these are the feelings that actually lead you to commit suicide. Now recently I had a case where there was this lady who was actually planning for an IVF, but unfortunately she was not able to go through because of the pandemic situation. And just couple of weeks ago I got a call from her husband, and he was saying that, and she did not come for sessions after that. She attended she came for 2 therapy sessions, and after that I did not hear from her at all. And just couple of weeks ago her husband called me to say that, ma'am, she has tried to commit suicide twice. So these are some of the it's like feeling of worthless. She was feeling so worthless that she was not able to manage to give birth to a child, or feelings of guilt, not able to take care of. She had reached a stage where she could not even she didn't even remember how to cook. Her husband used to just tell her that, you please make Maggie and give me, and she would say that I don't remember how to make Maggie. So that was the situation. She was in that bad a shape. So there were very deep feelings of guilt that I am not able to support my husband in whatever way I'm supposed to. On top of that, worthlessness, because I am not able to whatever, give birth to a child. So there were many things which were happening in her life, and this is how I came to know through her husband. So when you have feelings of worthlessness or guilt, that needs to be addressed first. Okay, difficulty thinking, concentrating, or making decisions. Now once you are in that loop, you will not be able to think properly, because most of your energy will be taken up in doing just the normal activities that you do every day. Just waking up, doing your normal brushing, going to the toilet, taking bath. Just your basic activities will consume so much of your energy that you will not have the energy to think anything else. And concentrating, you will not be able to. Some of my patients, they go to the market and they forget what they have to buy. So they give some money and they forget to take the change from the person. So that's it reaches such a stage where you become very, very dysfunctional, even in your daily activities. Even decision making, you are dependent on somebody else. Should I do this today? Should I not do this today? So there are so many questions that you have, and so many things that you're dependent on. You feel automatically there is a feeling of worthlessness. Recurrent thoughts of death or suicide, or an attempt at suicide. So there have been many cases of depression which I have actually seen, where suicidal ideation is very common. It's very, very common. They have thoughts of suicide. They have tried to even cut their wrists many times, couple of times, or tried something else, but it has not worked out, or they have not had the courage to go through the complete act. So but we have to be careful, we have to be aware and very cautious about such being around such people. So this is one thing. Some of them actually go through and see. One thing is there, that if a person wants to commit suicide now, he will not come to you. He will just go ahead and do that. Most of the times that is what I have seen. Recently there was this girl, a school girl I'm talking about. She must be in a 10th standard or something, and she had come to me with a history of sexual abuse in her childhood, and she was feeling a lot of worthlessness, guilt, a broken separate broken family she came from. And what happened was, one day she called me from the she was coming for sessions to me, and she called me in the morning from the washroom of her school, and she told me that, ma'am, I want to commit suicide, I don't want to survive. So then I spoke to her and I told her that somehow I managed I convinced her to get out of the washroom and take the phone to the principal of the school. And then after that they went to her house, and it was it's a big long story. So if someone wants to die, they will not call you, they're calling you because they are they want help. So like Radha Gopinath Prabhuji just shared with us, that even if somebody comes and talks to you about all these things, you should try and probe. Okay, why are you asking these questions? What is going on in your mind? So you should try and understand if the person has any ideations, or is planning on something. So this is something which we really need to be alert about. See, there are common causes of depression could be several factors play an important role in the onset, including one is genetics. If there is already one person in the family who has or one couple of people already, there's someone in the family who has depression, so there are very high chances that you could get it. So there is definitely a genetic this of family in the family. Then abuse. Now, as I just mentioned that this about this girl, any kind of physical, sexual, emotional abuse, either in the childhood or even currently going on, can definitely lead to depression. Substance abuse. Now, drugs and alcohol, these are the two things of which byproduct is definite depression. So there is no doubt, once you get into these things, depression is bound to happen, and it is bound to the low self-esteem, low confidence. All these things are part of substance abuse, and along with that, depression is also a part of substance abuse. Many times there are hormonal changes that take place within a woman's body, especially during menarche, that is just before a girl gets into her menstrual cycle. So that time there are a lot of hormonal changes happening, because of which she may have suicidal ideations. So another thing is postpartum is post delivery. There have been cases where people have come and told me that I feel like killing myself or killing my child, it's that bad. So at such times also they need a lot of support, they need a lot of love and care. So please be there for them. Then there are some medicines also which cause feelings of depression. I will not get into the technicalities. You can search, you can Google it on on a system. Now some people have personality traits which are pretty pessimistic by nature. The person is pessimistic by nature, cautious by nature, very suspicious by nature. So these people are more susceptible to depression, because their thoughts are only negative. They think in that manner, they automatically it will start going in that direction. So these people are more prone to depression. Then other illnesses, like when somebody is suffering from an Alzheimer's or insomnia, Parkinson's, or a diabetes which has been going on for a long time, and it has no there is no normalcy in that person's life, and is very disturbed because of this illness, or any terminally ill person. Most of the times when you see people with terminal illness, they will definitely be having some this of depression, because they know that they don't have much to live. So many of them don't know how to live the rest of their life. So that is one of the reasons why all these cancer hospitals and many other hospitals, they have a counseling center to counsel these patients how to go about living their life fully, whatever time period they have. And life events, I have always observed that there is some life event, something happening in our life which has triggered this feeling. There is either a relationship issue, or there is some fight which has happened with your friend. Then there is some job issue which has taken place, or there is a loss in the family. You've lost somebody whom you love. So there is some major divorce or separation in the family. So there are many I have always observed there is a life event, a life-changing event in a person's life, which starts, which sets the stage for this kind of, depression or moods or feelings. So now diagnosis is that each disorder has its own diagnosis criteria. Now these are all very technical stuff. It is available in some books, which we refer to on a regular basis. But we know that for diagnosing, what steps need to be taken. So first is you have to consult a mental health expert. Please do not think that you can solve the problem on your own. You are not Mr. or Mrs. Fix-It. It's not that every problem can be solved by Mrs. Gaukar. No, Mrs. Gaukar has her limitations, and she cannot solve everyone's health problems or whatever it could be. So we have to consult a mental health expert if we feel that there is somebody whom we love is suffering with this kind of a issue or a problem. Get the correct diagnosis, because sometimes there are people who are not able to diagnose also the illness properly or the disorder. They keep roaming around in circles. There is one girl who still comes to me and she tells that, ma'am, mujhe kya hua hai, mujhe bata do. Because I don't know her diagnosis at all, frankly speaking. The psychiatrist has told her that she has anxiety, but I feel she has symptoms of schizophrenia also. So there are a combination of things that are there sometimes, and because of which there's a lot of confusion. So getting the correct diagnosis is also very, very important. If you don't do that, then it could lead to more complications. So now this is the cycle of depression. How does it start? There is a trigger. It starts with a trigger or a stressor. This stressor could be anything ranging from a medical illness to work problem to family problem to relationship issues. It could be anything, okay, any kind of stress. So sometimes what happens is these things actually give rise to physical problems. It can be both ways. If you look at the arrow marks, it's both ways. So sometimes poor sleep, pain, low energy, poor concentration levels, and poor appetite. These could lead to this could lead to medical illness. Then medical illness could lead to some kind of depression. So these are all interrelated and go back and forth. It works vice versa. So whenever there is a stressor, there's a physical, there is some physical problem attached to it, like there's lack of sleep. Obviously, when you have a family problem or your work problem, I am sure a lot of us today are facing this issue today in this pandemic period. So there is you're affected with poor sleep. You're worried all night. What is going to happen to us? What is going to be our future? Because of all this, there is a manifestation in terms of pain in some areas. Because we are not able to express it in the right manner. It is manifested as pain, or chronic pain sometimes in some areas of our body. So energy level goes down, because if you have issues or family problems, obviously you don't feel enthused to do anything. Concentration reduces, appetite reduces. Then it leads to some kind of behavior issues. What are the behavior problems? Social withdrawal, decreased activities. You don't feel like going out. You don't feel like socializing. You don't feel like talking to anybody. Productivity reduces. You don't feel like working anymore. And there is a lack of initiation. You don't want to initiate any activity. You just take a step back. After that, it leads to thoughts and feelings, negative thoughts, low self-esteem, sadness, hopelessness. So all these things, if you see, it's like a cycle. It's a vicious cycle. And it is very, very essential to break this cycle. And you can break the cycle by actually working on your stressors. Stressors could be medical illness. Now that definitely cannot be broken. But you can improve your, level of, I could say, medical health or physical health. That is something which we can do. Family problems, you can sit and discuss. You can come to a solution to your problems. Work problems, that also can be sorted to a certain extent. And again, another way to break this cycle is to work on your negative thoughts. Thoughts and feelings need to be worked on. There is a therapy that we use regularly, which works very effectively in depression, which is cognitive behavior therapy. It's a researched and proven method. It has a wonderful track record. I've used it with many of my patients, and it has proved very, very successful in helping them manage their depression levels better. Okay. Now we can reverse the vicious cycle of depression also by increasing our activity level. Now remember one thing, that this can be what can be done? This can be done by it can be done only when it is at a mild depression level, mild or moderate level. When it is chronic, it has to, you have to go for medications. But at mild and moderate levels, increased activity, you improve your level of exercise, you improve your physical activity level, you start feeling more hopeful. When what happens when you exercise, there is something known as endorphins which is released in your body, okay, and it helps you feel that it gives you a feeling of a high. but also exercise also what it does is it releases actually it establishes new pathways in your brain. When you do sustained low activity exercises over a long period of time, it helps to create new pathways in your brain, which makes you feel good. It makes you feel better. So it is better to do exercises for a longer period of time rather than just taking up something for some time, feeling a high and going back. It's like, it's like a drug induced activity. So when you do it for a long period of time, you feel more hopeful, you feel, more happier, more satisfied. Your depression level reduces, okay, and you feel greater energy and you feel motivated to again go back and exercise more. Okay, there are some self-help techniques which I would like to discuss with you all. Under physical comes exercise, yoga, sleep routine, diet routine, and guided relaxation. Now, as I told about exercise, I just told you that the first thing that it helps you, generates endorphins that makes you feel high, and we should look at low intensity exercises over a period of time, which will improve the brain functioning over a period of time. The next is yoga. Yoga helps in what does help yoga? I'm sure many of you must be doing yoga regularly. Yoga helps in actually reducing stress levels, improving your general well-being, and giving you a good health, overall health, because you do some asanas and you do the deep breathing techniques and you follow. So it makes you feel better in a holistic manner. Okay. Next is establishing a sleep routine. Now, for patients suffering from depression, establishing a sleep routine is very, very necessary. Sleep routine and diet routine. Because unless and until your sleep routine is not set, your next day, like suppose you sleep properly for one night, the next day you will feel energetic enough to do your activities. So once that routine is set, for a period of 1 week, then you feel, energetic, and you feel more motivated to uh, be more active throughout the day. Look at your work in a more enthusiastic manner, take things more positively. So establishing a sleep routine is very, very essential. There are various ways that you can do that. One is definitely, if it is chronic, you have to go in for medications to have a set sleep period. Otherwise, there are, as I mentioned, guided relaxation techniques are there, guided meditation techniques are there. But there also you have to remember in guided relaxation that if you feel uneasy anytime while doing the guided relaxation technique, you have to stop and then consult somebody who is in the mental health profession, take guidance from that person. That means it is more deeper than what you are thinking. Diet routine, again, it is very easy to take shelter of comfort foods. So we should try and avoid that and eat more of healthy food, which keeps us more active, which makes us feel lighter. Now, on the mental level, meditation is one thing which helps in the long run. I always ask my patients to spend some time, 10 minutes, doing some meditation activities. It could be deep breathing. It could be listening to some spiritual talk. It could be listening to some, motivating talk, or whatever it could be, which, something which is positive. Spirituality is something which we all believe in strongly, taking shelter of some supreme power, which will because all of us know at the end of the day that nothing is in our control. So when we take shelter, we become humble, we try and accept the situation as it is. And another thing is that we realize, since nothing is not in my control, we need to focus only on our circle of influence. Whatever is in my control, only my feelings, my thoughts are in my control. So can I change that? Can I change myself? Can I convert my negative thoughts into neutral and then into positive? So that is what we work on. Then last but not the least is that hang on tight. This is something, depression is something which is not going to be there forever. If you work on it consciously, and with full enthusiasm, it will definitely go. Because I have seen many of my patients, coming back and saying that, ma'am, we are feeling so nice now after, taking the medications, working on ourselves. So they're pretty successful in their lives. So you just need to hang on, you just need to think that, okay, this is not going to be there forever. It will pass. This too shall pass. Okay. Then hold on to positive memories. Now, for example, I can, whenever I remove the old photographs of my daughter, I feel very nice, when her childhood photographs, it gives a very good positive vibe whenever I'm going through those photographs. So that makes me feel very positive. So similarly, you must be having some positive memories either of your childhood or with your parents. I'm sure something positive should be there. So you just hold on to those memories. Okay, now we come to something called social and professional. Now in social, we have relationships. So what you need to do, because in depression, as we saw in the cycle of depression, you don't feel like going out. There is a lot of social withdrawal. So you have to literally force yourself to go out. There was this client of mine who would say that, ma'am, मुझे कहीं पे भी जाने का मन नहीं करता है. मेरा friend नीचे आता है, he comes down and he waits for me, he calls me, but I don't feel like going down and talking to that person. So you have to literally push that person to go and meet people. He may get anxious initially, so you have to train them. It's like, conditioning them, reconditioning them again to get back into a social life. So it is very important. There was a client of mine who was fearful of even going to a bank. She's like, no, they will ask me many questions and I will not remember the answers. So these are the kind of things that happen to you. So you have to push yourself to go out, meet your friends, try and make your life as normal as possible. Of course, now it's not possible. So video calls, phone calls, be in touch with your friends regularly, family, relatives, talk with them, share your heart. It's very, very important, and don't feel ashamed or embarrassed to share what you feel. Accept it. If you have some problem, accept it. I'm sure there must be somebody who can help you. Okay. Now, one thing which I remember, reading about what my spiritual master had mentioned is that great people always feel that they need help, though they don't. But people who need help think they are great. So, this falls into the, if you feel that you are great, you will never reach out for help. But great people who are great will always want to, although they don't need help, they reach out for help. So what I would say is that please put your egos aside, please put your whatever issues you may have, please put it aside, and if you feel that you genuinely have some issues, please reach out for professional help. Talking and sharing also helps. Now, psychotherapy and medications. Now, psychotherapy, there are many therapies, but what we mainly use, or what I mainly use, is cognitive behavior therapy, which has been very, very effective in helping patients manage their negative thoughts and feelings. And also that the therapy that we choose depends on the patient, actually depends on the client, what is the intensity, frequency, or how chronic the problem is in the person. So accordingly we choose that issue. Now I'm sorry, I forgot the social work part. Is that under social work, it says that first you have to help yourself. Okay. Now, unless I help myself, I cannot go out and help somebody else. So that is one thing that you have to remember, that unless we help, self-help is the best help. So first you help yourself and then go out and do work in the society. The last is medications, which is again your choice. I would recommend it, but choice is still yours, because there have been times when I have seen that without medicines, people have actually lost their loved ones, or things have gotten really complicated in some cases. This is one topic which everybody had asked me last time when I did this session, that how can you help a loved one? Now, the first thing that you can do is listen to them. Now you hear them out whenever they have to speak something about their issues, you hear them out, but be empathetic, don't be sympathetic. Okay, if you become too sympathetic, you will also drown in their sorrow. So then it will be difficult for you to actually then come out. You will become a depressed patient. So slowly you have to, next is you help them to find support. So gradually, as you keep talking, as you realize that this person needs help, you identify people for them. You tell them that I know of this person who can help you. Would you like to go there? And if he or she says yes, you support them in continuing the therapy. You accompany them for therapy, and you be with them. That is more important, so that person knows that if something happens, I have someone to fall back on. I'm not all alone in this battle, or whatever, against depression. So, and take care of yourself, because sometimes what happens that in the process of taking care of so many people around us, or even one person in the family, so much of your energy is utilized in doing that you forget to take care of yourself, and you'll end up getting sick. So that is first, jivana sarthaka kari karo kari paropkar. So first you have to take care of yourself and then others. So sometimes it is necessary that you become a little selfish. You have to set boundaries, because what happens is, I've seen, when we start listening to them and we start hearing them out, they keep calling you on and off, during the day. I have had a lot of this experience where people just keep calling any time of the day. Ma'am, can you help us? Mataji, can you help me? This is my problem. That is my problem. But I tell them that right now I'm busy, but I will call you back at this time. Or I always tell them, nowadays I tell them, please take an appointment in advance. So what happens is, you're setting your boundaries. You know that, okay, at 6 o'clock I have this today, at 7:30 I have to talk to a client tomorrow. So we are very clear, we are setting the boundaries. Okay, there will be times, there may be exceptions, because that person is very close to you, he will call, he will cry. So you can just, at that point in time, just calm him down and then tell him that I'll call you back later, him or her, whoever it may be. So how can you help a loved one? You have to also have some knowledge about depression. That is important. So read up, understand what this is, and then you can help them better. Offer to help with everyday tasks. Now, if it is someone in your family, it is very, very important that you understand that depression has made this person dysfunctional. So when you help that person in their regular everyday tasks, they don't feel so worthless. It's like, providing that support that they require at the right time. So it helps them to come out of that situation quickly. So they know, okay, if I'm not able to do this today, my husband or my wife can do this for me. So that is the kind of rhythm that you need to set with your family members. Extend loose invitations even if you know that they may not accept it. So if you have some social gatherings, some picnic, some party, some bhajan, satsang, it could be anything, a birthday party. So just keep extending. We know that this person is not going to come, but just keep telling that, tomorrow we have this, next week you're going out here, so can you join us? You never know, he or she might just decide to pack up and come with you. So that may be a changing point in their lives, because you have been inviting them on a regular basis. And last but not the least, be patient, because you require a lot of patience to handle such patients. And it's not easy, believe me, but if you can do it, it's wonderful. So now we come to this part of the pandemic twist. Now, what is this pandemic twist or the pandemic? We're talking about pandemic effect. All of us are going through a lot of social isolation now, frustration, feeling cut off, economic and job uncertainty, fear of death, self and loved ones, and troubled relationships. Now, all these things, in the last 3.5 months, each and every one of my call which I have received from either my clients or anyone from my building or from anywhere in Bombay or even out of Bombay, there have been cases of people feeling cut off, lonely, they are jobless, they don't have money, then and many times fear of corona. So that's fear of death. What happens if I die? What happened if my family, loved one in the family dies? So that is there. And also because of this, since families are in the house 24/7 together, there is a lot of relationship issues which are going on. People are waiting to probably for the pandemic to get over, and they may just go ahead and just file for divorces or whatever it may be. But this is a fact today. So if any of us are feeling that way, or if anyone is going through that, please believe me, you're not alone. All of us are in this together. So there is an anxiety depression cycle. What happens is that in this cycle, because of this pandemic, there are many people who are getting anxious. They're getting a lot of worries, they're getting a lot of thoughts about what happens. What will happen if I get a bad throat today? What will happen if I get fever? What happens if I have to get admitted in the hospital? Do I have that kind of, so there is a lot of thinking which is going on in the mind. So what happens is that when there is so much of worry, the brain becomes overactive. It is doing is overworking, and after some time it becomes tired. And when it becomes tired, the cycle of depression begins. Low moods, low energy, and again negative thoughts, and again back to anxiety. So this is again another vicious cycle which is taking precedence in today's situation. Next is obsessive negative thoughts. Again, the part of this suicidal ideations. Many cases are coming up with people coming said, "Ma'am, we feel like committing suicide. I feel like jumping out of the window. I feel like doing this." So that is something which is becoming very, very common today. Daily onslaught of bad news every day, whether it is a newspaper, whether it is your Times of India online, you NDTV, see whatever APTV, Aaj Tak, Kal Tak, whatever news channel you open, they are only talking about so many people died today, so many people have got corona, or so many people have recovered. So that's all you're hearing. What has happened to China, what is China doing to India. So nothing but bad news is what we are getting. So the only solution is just switch off your TV and your mobile phone and sit for some time during the day. Especially this news now, this is all unreliable. So please don't rely on this news, whatever comes on TV and these other social media. And also there is a loss of loved ones. That is something which I have seen. Many of us have lost family members, not only due to corona but many other things also. So there have been cases where I've seen where people have got anxiety. One person got was infected with corona, with COVID, and within couple of days, my husband shared, within couple of days he died of heart attack because of anxiety. So these are all the things that are happening. So we don't know. There are sudden deaths. There are people living, old people basically who have been with us for so many years. So that makes us feel very sad. But all of us, we have to remember that we are all in this together. None of us are alone. We can still reach out to each other, at least, if not to professionals, at least reach out to your friends, talk to them about your problems or issues. Please share. That is what is important now. And we need to change our focus. We have to distract ourselves from this daily onslaught of whatever we are getting. First thing is, how will you distract yourself? There are many things that you must have done before this in your life, earlier in your teenage, or some hobbies or some things which you liked, something of your interest. Please take up those hobbies. Distract yourself, because the more negatively you think, the more deeper you will get into this trap of depression, or trap of negative thoughts. I would not say depression, because just because you think negatively does not mean that you will fall into depression. Even getting into the trap of negative thoughts on a regular basis is not good. So you need to distract yourself with something positive, like you like to sing, you would like to listen to music, or you're doing some art and craft activities before. So it could be anything. So just take it up. Or in fact, I know one of my clients who just told me recently, I was talking to her, she said, "Ma'am, I used to learn guitar once upon a time." So I suggested that you take up learning guitar again, and she's feeling much happier. She's just had 2 sessions of guitar classes, but she's feeling much happier. So if you distract yourself with some other activity, that is one thing that you can do. Find simple sources of joy. Spend time with your family, spend time with your children. They are the most innocent and joyful people that you can find around in this difficult times. The the cheer and their innocence itself will bring you back to life. Then limit your consumption of news, mostly because they're mostly unreliable. So please don't believe everything that you see on the news, and try and limit it, because what is the point in reading a news which says that today 100 have been infected, tomorrow 200, day after 3, or now it has become flat. It doesn't make any difference to us sitting at home, because we are at home only. Nothing has changed for us, frankly speaking. We are at home, we still have to take all the precautions, we have to be cautious, still we cannot get out of the house. So the situation remains the same for us. Just the news outside is just changing with just the numbers, only the statistics are changing. Maintain a routine. Now I'm sure in the last 3.5 months a lot of our routine has gone for a toss. Our sleeping habits, our eating habits, exercise, recreation, everything has gone for a toss. So we need to bring it back online, on track, because sooner or later we will definitely have to go back to work, we'll have to get back to our normal activities. So having a proper routine in place is very, very essential, even now under this situation. Okay, so you sleep on time, you wake up on time, exercise on time, eat your food on time, do your have some recreation activity, that also has to be on time. So routine has to be set. Last but not the least, express gratitude. It really provides respite in bleak times. So whatever we have today, we have to look at the situation outside. Whenever I see outside my balcony here, I see all these workers, they are living, there's some construction work going on next to our house, and then I can see the workers, the way they are living. There's so much of water in and around them in this rainy season, with so much of mosquitoes, such bad living conditions, but still they are working just for their survival. Do we have to do that? No, we don't. We are living nicely, we're living in a room which is comfortably air conditioned, we are having wonderful meals, 3-4 meals in a day, whatever we want we are getting on Zomato or Joby have. Whatever ingredients you need, you're getting most of the things. So let us be grateful for whatever we are getting as of now. So gratitude to God, gratitude to society, gratitude to our employers, gratitude to our temple, who are trying to give us so much of spiritual also, so much of spiritual talks are going on, discourses are going on in the temple, which also keep us inspired and motivated over a period of time. Then find ways to be connected to friends and family, which I've told you, video calls, phone calls. There are many ways now which you can do. Move beyond small talk and share about yourself. It should not be just hello, how are you, what are you doing. No, share, open your heart. This is the right time to do that, and you will feel better after doing that. And nothing needs to get fixed. It's not that once you share, or somebody shares the problem with you, you have to give a solution. No, it's not required. As I told before, we are not Mr. or Mrs. Fix It. So nothing needs to be fixed. Just hearing out and understanding what that person is going through is more than enough. See, even in the current times, it will be very, very easy to slip into bad habits, because you're feeling so lazy and lethargic, unenergetic, your routine has been disturbed. So healthy habits need to be adapted. Eating good food, as I told earlier also, exercising, that eating good food, sleeping on time. So avoiding comfort food, that is what is important. And get moving and exercising. As I told you, exercising is critical, very, very critical. Whether it is at home, if you can't go out, do yoga every day at home, but do it. It has to be a part of your routine. Exercising has to be a part of your routine, because it will help, as I told you, it will help build a new pathway in your brain, and your brain functioning will improve. Whether you have depression or no, it is required now, because all of us are susceptible. Anytime it can happen to any of us. So as I told, anything can happen to any one of us at any time. So we have to be careful and beware. Avoiding comfort food is one thing. So I'm just summarizing the session of today's session. The depression can happen to anyone, you, me, anyone around me. If identified in early stages, it can be reversed and it can be managed. Please do not hesitate to seek help. It's not a taboo, and better to combine medications with therapy. So thank you very much for your patient hearing. If you have any questions, please, I would ask Deepak Barwani Prabhu to take over now.
Thank you, Mataji. That was a very comprehensively presented workshop. Really hard to find questions because you've covered most of it. However, there are some questions. What we have seen is that accepting the fact that you're depressed, or your family members accepting the fact that you're depressed and you need help, seems to be a bottleneck to seek help. I don't know if this is a question or a comment, but
no, it is. That's why I have been emphasizing throughout the presentation. You must have observed that it is very essential. If you see that there is a family member, who needs help but does not want to seek help, what can you do in this situation? Is that what you are asking, Prabhuji?
I'm sorry, Mataji.
Are you asking that there is a family member who needs help but does not want to seek help? Is that what you're saying?
Yeah, mainly they are trying to hide away from the fact, or they are not accepting that they have a problem.
Okay, see, what happens is that unless and until a person comes to you and tells that, I have a problem and I need help, you cannot forcefully enter into that person's life. Yeah, of course, if it is a husband and wife, you can definitely say that, can we at least go and get yourself or get ourselves checked once, to just rule out any possibility. So that is something which you can suggest. But even in spite of that, if that person is not willing to, seek help, then you can just support in whatever way you can, which I said now, how you can support your loved ones. That's the only thing that you can do, because unless and until it comes from the person within, it's like, when you are addicted to alcohol, unless and until you accept that you have a problem, the problem, you will not be working on it. It is someone else who will work on it. You're getting my point? You may take that person forcibly to a de-addiction center, but after 3 months or 6 months, once he is back, he or she is going to again start off, So unless and until it comes from within that person that I want to be better, I want to feel better, and I want to do it quickly, that person, till then it is not going to happen.
Yeah. Thank you, Mataji. So self-acceptance is the start of the problem-solving process.
Exactly.
Mataji, there is another question where depression may set in a little later. Before that, there may be sadness, there may be general anxiety. So as a family member, if I proactively do something about that, can I avoid, reaching the stage of depression?
Yes, you can avoid it. Like I said, when you support your family member through whatever ways and means, see, there are times when you feel that you can handle it. It's not so much. You can help the person, you can extend yourself. But again, as I said earlier, you need to set boundaries, because at the end of the day, you are not trained or qualified to handle this. So at any point in time, you reach a stage that you cannot handle it, you have to reach out to somebody. And then you have to tell this person that I'm sorry, but I cannot handle it anymore. I think both of us need to go and seek help, So that is how you can manage this situation.
Okay, so basically one can proactively deal with it. If you deal with certain challenges, issues, emotional concerns of people around you, it can be a big help to avoid getting into a depressed state.
Yes, definitely. And also, if you open up and speak, that's another thing, See, I may be having some problem, and you may be a wonderful person who listens to you, who listens to me, and who understands my emotional problems. Is unless and until I share it with you, you will not be able to understand what's going on. You are not a mind reader, it's not telepathic. Yeah, you can understand some symptoms that, okay, this person is not participating fully in family activities, or not as enthusiastic as before, feeling very lethargic, So there are some things that pointers that you may get, but unless and until it is diagnosed properly, you will not be able to identify what is the problem. It could be something deeper, it could be something else. It may not be depression also, it may be something else.
Okay. Mataji, I have been chanting for many, many years and I'm following the path of bhakti. Do you feel I need mental help? Can I take the help of scriptures and chanting to overcome my depressed state?
If you ask me, there are many people in our congregation who are currently my, or I should say, okay, let me come out clearly to you. Let me not beat around the bush. I don't think that only chanting or only taking shelter of scriptures is going to help in dealing with chronic cases of depression. Okay. Anything, like suppose you have a heart problem, or suppose you have something related to, or even you have a chronic back problem. Okay. Do you think by chanting it is going to recover? It will not. As you do not have control over other functions of your body, similarly, you don't have control of your mind also, right? So you need some help, some guidance to help you through. There was this question which was asked to a very senior person earlier also, that why do we need these psychological tools? So psychological tools are just to help you cross. They are not the only things. It is just going to help you cross from one side of the river to the other side. Once you reach there, you already have spirituality, you already have chanting for taking you through this. So I have many patients from people who from the spiritual background who still come to me for therapy, for counseling, for medications. They approach psychiatrists. So it's not that just by chanting or reading scriptures your mental health is problem is going to get solved. It's like any other disease.
Thank you, Mataji. Mataji, one last question.
Yeah.
Is we've seen that people who are depressed may not have any valid reasons to be depressed. They may be in a high income family, they may have very sweet relationships, nothing untoward is really happening in their life, and suddenly we find that they have taken the extreme step. So what do you think is the reason for that?
See, Prabhuji, there is always a reason behind somebody taking such an extreme step. There is always, there has to be a trigger behind this. It may not be a recent trigger. It may be a trigger from the past. See, when I say feelings of worthlessness and guilt, if you remember the presentation, those are very strong triggers to, take extreme steps. That's why it needs to be worked on. There are people who have been, abused in their childhood, who may take a step now, because they are living in the same family, they're living with the same members. So always they are in the fear that this person is going to hit me, or this person is going to emotionally abuse me, or I'm going to get sexually abused by somebody. So that fear is always there. So they're in constant, living in constant fear of that thought. Or it could be anything of, in the past I did that, and this happened, I was not a success, I was a failure. So what is going to happen now? So there are many things, but I am sure there is something attached to this particular event. It cannot just happen out of the blue. There has to be a trigger. It may be a trigger from the past or from the present.
Okay. So Mataji, I'm really tempted to ask one more question related to this. We've heard that some people are bipolar, some people have OCD. So, maybe these are also contributing factors to, getting depressed. Because
bipolar and OCD are different problems altogether. Yeah, bipolar is, either you are at a manic level where you are very happy, very ecstatic, or at a very, very low level, so your mood keeps fluctuating between both. So it is a part of depression, but it's a disorder. Okay, it does not, it comes under one of the types of depression. OCD is something very, very different. It is an obsessive compulsive disorder. Okay, it's either an obsessive behavior or a compulsive behavior, so now nowadays compulsive behavior can also be that of mobile addiction, watching porn continuously. So all these things, and behavior could be washing your hands. After pandemic, all of us are going to become obsessive about washing our hands. So that is one thing. You're very particular about cleanliness. So these are all there are many other things. Some people hoard books, they hoard stamps, some collections they have. So, and it is in a very disorganized manner, it's not organized. So these are all it cannot be connected to depression. But yes, depression is one of the byproduct of OCD, because you have sometimes in fact now most of the times you're seeing that people who are coming for help are people with obsessive negative thoughts, negative thoughts of death, negative thoughts of hurting others, sexually perverted thoughts. So all these things are actually now becoming very, very rampant nowadays, and this is what we are treating on a regular basis with people with OCD.
Okay. Mataji, I'm tempted to ask one more question. In your experience as a counselor or as a psychologist, do you see that the number of problems are increasing day by day? And is it more with the younger generation? And if that is so, what is the fundamental reasons? What are the fundamental reasons behind these problems?
Okay, definitely the current as much capacity as we had earlier, because their resilience level is very low. Their ability, by resilience I mean the ability to bounce back from from any difficult situation. So even if see, I would also blame parents a lot in this, because whenever something happens, they are there to mollycoddle them. It's okay, I'm there. So the decision making, the problem solving, and addressing the issue directly by the child is very little, very less. It is the parent who is addressing all these issues and taking solutions on behalf of or taking decisions on behalf of the child. So what happens is the child does not learn in the process, and as the child keeps growing up, becomes a teenager, the same habit remains. So anything happens, the parent is there. So where is the strength building coming in the child, in the in the boy or the girl, in the teen? So what are we giving our generation today? Like when we used to fall down when we were child, mothers or fathers used to say, "ठीक है, सब लोग को होता है," but we don't do that anymore. We want to tell them, okay, you're feeling hurt, you're feeling, that's how we are also training parents. That's another part of it, but at the same time, we also need to build their, resilience level, their ability to fight back, their ability to tolerate. The tolerance threshold has to be higher. So all these things are actually the what I should say, cause of children getting depressed. So many students are committing suicide. I mean, it's like a very common thing nowadays. In fact, in where we stay, a 12-year-old boy committed suicide because he was not allowed to go out of the house during the pandemic. So I mean, is this a reason to commit suicide? But that the level of maturity and also of facing the current, facing any problem is very low. They give in, they're not persistent, they're not persuasive, they cannot fight back. So all these things we have to teach our children. It's very important right from a small age. So then they grow up into resilient adults. At the same time, I'm seeing adults who are, say 40, 45, who have been through so much, but they're still sustaining. Why? Because they have that strength. Mental strength is strong.
So it's like a gardener who's planting a tree and or rather planting a seed. He needs to know how much protection is good for the plant. If you overprotect, maybe the plant will not be able to sustain the winds of time when the gardener is not present there. So thank you very much,
Absolutely
Mataji.
Right.
Thank you very much, Mataji, for this lovely presentation.
Thank you so much.
And I'm sure this is going to help a lot of us look around and help in a really helpful manner. And thank you very much, everybody, for joining in. This just shows how much you love the people around you. And please spread the love and care around. Thank you very much. Hare Krishna.
Thank you. Thank you very much.